is Rohit Om Parkash, and he'll be talking about flap motility sign in PCR.
Thank you, Dr. Gaurav. Thank you, Dr. Gaurav, for giving the opportunity. Well, I would be talking something which would be relevant to each one of us. There are more than, can you switch it on? There are more than 8 million phacoemulsification procedures which are being organized in 1 year. 0.8% of them have anterior capsular tears. So this means that there are more than 65,000 times that we have an anterior capsular tear. Phacoemulsification at times can be completed successfully, but then there are times when we have nucleus drop. The surgeon obviously is always in a dilemma in such situation, whether to convert to ECC or to continue with phacoemulsification. We are fully aware of the signs of PCR. That too, the pupil snap sign by Ronald. But then, these signs of posterior capsule rupture have their limitations when it comes to anterior capsular tear, because they do not appear instantly and there is a time lag for recognizing them. Well, I present a flap motility sign to end your dilemma when it comes to anterior capsular tears. If the flap is everted and fluttering, mark my words, it's pre-equatorial, because the short length of the flap is responsive to the anterior segment fluid dynamics and it flutters. I would like you to focus on the trypan blue stained anterior capsular tear. If it is fluttering and everted, for sure, if you continue with safe phacoemulsification techniques, it is pre-equatorial. There is no need to be in a state of dilemma. Is it something new which is happening? No, it was there, but there was an oversight. The next thing is, what is the investment which is required? Do we need to have that PDT machine? No. We just need to have a smart vision. Smart vision by means you extend your vision sideways and you will know whether it is pre-equatorial. What happens when it extends beyond the equator? When the flap extends beyond the equator, as you will see, it stops fluttering and it becomes inverted and flat. What happens usually? There is a highly pressurized anterior segment and a low pressure posterior segment. With a breach in the posterior capsule, what happens? The high fluidics in the anterior segment and the negative pressure behind pulls the anterior capsule down, which causes an increase in the capsular bag volume. Now this is a video wherein the resident is trying to enlarge the capsular axis. Eventually what happens is there's an anterior capsular tear. You can see the flap fluttering. He's going on with his routine technique, but in an effort to divide, the flap stops fluttering. Now what does that mean? He was oblivious of the flap motility sign. He continued with phacoemulsification and eventually he had a posterior nuclear drop. So this is what would have not happened had he known about the flap motility sign. So this flap motility sign is for each one of us, be it a novice surgeon or intermediate level surgeon or all of those who are trying to teach phaco. Well, clinical ophthalmology has approved that. It's a hitting on the bullseye. There is no dilemma. Flap motility sign is there to end the dilemma. of the extension of the anterior capsular tear to know whether the PCR is there or not. Thank you very much for your kind attention.